Good evening. My name is GenaRoberson, and I am a registered nurse certified case manager. Today's presentation will be an overview on how the interdisciplinary team can take an active approach in improving clinical outcomes of heart failure patients. The ACTIVE approach is an easy acronym that can help the interdisciplinary team remember the most important goals in managing heart failure outcomes in the hospital setting using evidence-based guidelines to reduce the risk of 30-day readmissions and mortality rates in the heart failure population. The goals are to avoid and reduce preventable hospitalizations in the heart failure population, condition and symptom management using evidence-based guidelines in managing heart failure and underlying comorbidities, appropriate transitional care and discharge planning, an integrated team approach, making sure the patient has a post-hospital visit scheduled within 72 hours of discharge from the healthcare provider, and early engagement and education with the patient and caregiver should begin at the time of the admission until discharge, providing them with plenty of opportunities to learn and ask questions about their disease process before they are discharged to the home setting. 5.7 million Americans are living with heart failure. It is one of the most common diseases and reasons for hospitalization in people 65 years and older. Heart failure is the leading cause of hospitalization and 30-day readmission rates for Medicare recipients, contributing $17.4 billion annually to Medicare costs. African Americans are more likely to have heart failure than people of other races. Males often have higher rates of heart failure. However, females have higher rates of hospital admission for heart failure. Hospital admission for heart failure is extremely common and quite expensive, although it is frequently preventable. New drugs and therapies for heart failure have been reported to reduce admissions, decrease morbidity and mortality, and improve quality of life. Healthcare providers need to use clinical judgment, knowledge, and expertise in deciding whether it is appropriate to apply quality guidelines. These are merely recommendations and serve only as a guide and may not be appropriate in all situations. They must be implemented with the consent and wishes of the patient. Best practices for managing heart failure according to the Agency for Healthcare Research and Quality are diagnosis, referring patients with suspected heart failure and previous myocardial infarction to have multiple tests to be confirmed by a cardiologist. Treatments: patients with an ejection fraction of less than 40% should be treated with ACE inhibitors, beta blockers, aldosterone antagonists, ARBs, to improve symptoms and prevent progression of heart failure. Hydralazine and nitrates are recommended for African Americans with heart failure. Taking more than one medication can increase the risk for side effects. Healthcare providers and pharmacists should be provided a complete list of medications, including over-the-counter and herbal supplements. Cardiac rehabilitation should be offered in a supervised setting to include a psychological and educational component in the program. Monitoring should include a clinical assessment, fluid and nutritional status, cardiac rhythm, cognitive ability, a review of the medication, and routine lab. Discharge planning: patients with heart failure should generally be discharged from the hospital only when their clinical condition is stable and the management plan is optimized. The timing of discharge should take into account patient and caregiver wishes and make sure the level of care and support in the home setting is sufficient. Heart failure is the fastest growing heart condition in the United States and is associated with high risk of disability and death. The most common risk factors that contribute to heart failure are coronary artery disease, hypertension, previous heart attack, obesity, smoking, and alcohol use. All these conditions contribute to a poor supply of blood to the heart and place excess strain on a weakened heart muscle. Interventions to reduce risk: limiting sodium and fluid in the diet to prevent the accumulation of excess fluid in the body, taking medications and using oxygen if needed to reduce the demands on the heart, daily weight monitoring to identify weight gains that can potentially result in heart failure exacerbation or hospital admission if not addressed in a timely manner, smoking and alcohol cessation, as these can contribute to elevated blood pressure and arrhythmias, staying up to date on influenza and pneumonia vaccination to reduce risk for upper respiratory infections, and incorporating exercise into the daily routine routine to increase physical independence, tolerance, and weight management. Heart failure is a condition that causes the muscle of the heart wall to slowly weaken and enlarge, preventing the heart from pumping enough blood and oxygenation throughout the body. Weakened heart muscle prevents the left ventricle from pumping enough blood, causes fluid to build up in various parts of the body, resulting in heart failure. As a result, the blood backs up in the venous system, resulting in pulmonary and aortic. Heart failure develops over time. Heart's pumping action grows weaker. The condition can affect the right or left side of the heart, or it can affect both sides. The onset of heart failure symptoms can develop very quickly or gradually, resulting in shortness of breath, weight gain, confusion, fatigue that all contribute to a decline in the patient's physical and social status. Diagnostic data to confirm the presence of heart failure should include a thorough medical and family history, head-to-toe assessment, 12-lead ECG, blood work, chest X-ray, biochemical markers, the BMP blood test. After a diagnosis of heart failure has been confirmed, the healthcare provider should assess the severity, etiology, precipitating factors, type of cardiac dysfunction, correctable causes for treatment, using pharmacological and non-pharmacological approaches. Appropriate management and treatment of patients with heart failure is to prevent or delay the progression of disease and complications. Treating the underlying issues and comorbidities such as hypertension, diabetes, hyperlipidemia, reducing heart failure symptoms and stress. Preventive care to include routine testing and blood work, scheduled follow-up visits with primary care physician or specialist, and medication adherence can improve heart failure symptoms and quality of life. Non-pharmacological intervention, in addition to pharmacological interventions, can help patients feel better and live longer lives. It is imperative that the patient be provided participate in self-management strategies that include daily weight monitoring, avoidance of alcohol and smoking, following physician orders, keeping scheduled appointments, losing weight, adhering to diet and fluid restrictions, resting and exercising in moderation, notifying the physician when signs and symptoms are developed right away to effectively manage heart failure in the ambulatory setting. This will reduce preventable hospitalization. Healthcare spending for heart failure exceeds $39.2 billion per year, representing 1 to 2% of all healthcare expenditures. Hospitals are now being financially penalized for 30-day readmission rates. Nurses are an essential part of the interdisciplinary team and serve as primary role models in the promotion of health and wellness. They are ideally positioned to lead initiatives to reduce avoidable readmission. Nurses have multiple job roles in the hospital setting in reducing hospital admission. They have the responsibility of preparing patients and families for discharge, collaborating with multidisciplinary teams, coordinating safe, quality patient care. Nurses can have a great impact on improving heart failure outcomes and mortality rates for patients and healthcare organizations by increasing patient participation in self-care strategies using evidence-based approaches to managing heart failure. Each year, over 1 million people are admitted to an inpatient setting for heart failure. The national average mortality rate for heart failure during a hospitalization is 2 to 7%. Patients in the outpatient setting, a hospitalization is one of the strongest predictors for increased mortality. Most hospital admissions and emergency room visits for heart failure are preventable and are often due to poor compliance with medication, diet, inadequate emotional and physical support in the home, poor communication among healthcare providers, failure of the interdisciplinary team to provide education and organize follow-up care after a previous hospitalization, healthcare providers not emphasizing the importance of non-pharmacological approaches to managing heart failure. Currently, heart failure has no cure. However, lifestyle modifications and medications can help patients live longer and more active lives. Having a standardized process to effectively manage the heart failure population, such as an active approach, can serve as a guide for the interdisciplinary team to use into their daily practice, effectively managing heart failure patients reducing readmissions, and improving patient outcomes.